Hello and welcome to the special edition COVID-19 Rogers television program. My name is Carol Merton, and today I'm delighted to welcome as a guest Francesca Dobbyn, who is the Executive Director of the United Way of Bruce and Gray. Have I got that right, Francesca?
Yes, you've got it right.
Thank you for joining us today. I know that you have so much to share about how our community is doing and how United Way is supporting our community as we continue to move through COVID-19. So we were chatting before the program that really there's more than COVID-19 happening right now, but it's all interconnected. So I'm wondering if you'd like to discuss all of the issues facing our community that are intertwined with COVID-19. Homelessness, opioid, housing.
All the things. And I just want to start by thanking everybody in our community for all they're doing, masking up, everybody out getting a booster, everybody who's checking on their neighbor and shoveling walks and shoveling driveways and doing all those things that just make Bruce Gray such an amazing place to be. It really matters, and it's what's getting us through these difficult times is leaning on each other and talking to each other and finding some funny moments. Yesterday was Groundhog Day, and I keep the little guy close.
Oh, excellent. You don't have a hat on. Usually I see you at the later moments wearing your variety of your hats.
Oh, yes. We did that with Let's Talk Day with Canadian Mental Health. I had a squid hat on. There's always something within reach when I'm on a Zoom call to kind of have a chuckle about things. But as much as, we are finding those light moments to enjoy and engage and get out and do some skating and get some movement out, there's a lot of concerns around where the pandemic is leaving people behind. We have a housing crisis. We have homelessness on the street, people sleeping rough, trying to find a place to put people so they don't suffer from the cold on those coldest nights. And that's that housing crisis of affordability. When you only have a budget of less than $500 to pay for a place to stay for a month, and hotels are $2,000 a month, how do you exist? How do you live? So, and then, when all of those things pile on top of each other, it's no surprise that our opiate crisis continues to see overdoses. We see deaths happening in our community, and there's a great concern of how we're coping with all these things.
Yeah, and we know from the statistics that the numbers of opioid deaths are rising, but also opioid overdoses that may not result in deaths, but because of intervention have not resulted in deaths. People cope with stress in a variety of different ways, and there is no doubt this is stressful times. It's gone on for a long, long time. And are you seeing reactions of anger in the community? I know on social media, oh my goodness, there's no longer ankle biters. They're right up to the knees now. It just seems like people are becoming aggressive. Are you experiencing that in your service provision?
We see frustration, and when frustration comes from a place of needing something and not able to achieving whatever it is, and then if that's left too long and it gets left to fester, then it becomes the anger. Yeah. And somebody was talking recently to me about the goalposts keep moving. So, when the vaccine finally got here, okay, this is our way out, and then Omicron hit, and it was like, okay, we're back in it again. And that's frustrating. And it divides our society between those who are following science and those that are following all the rules and those that are just done. They're just done. And I get it. I get being just done. But the risks to others is still there and it hasn't gone away. So we're not out of the woods yet. And we just got to keep talking to each other. And, when we talk about the opiate crisis, one of the big messages for people who use substances is don't use alone. So if it does go wrong, there's someone else who can help you with the Noxalone. And what did we tell people at the beginning of the pandemic? Go be by yourself. Stay in your bubble. And those cross messages really hit that community really, really hard. And so we're still with that message of don't use alone. And I do know some of the interventions that we've started in the last few months are paying off. We're seeing a lot less overdoses being called in. There's still a lot of use out there, but people are connecting to the services. So it's still a crisis. It's still a healthcare crisis that's being treated as a policing crisis and a law enforcement crisis, but it's a health crisis. So, we've got some new programs hitting the ground around substance use. We're bringing supports to the people. So we have supports out in the community, and we have a multidisciplinary team that's starting to address those needs, and it's already making an impact. We've only just been on the ground for a couple of days with this, and we're already seeing connections with people so they don't feel so alone in this.
Excellent. As we move through COVID, and we have to keep saying that phrasing, we're moving through it. We're getting into that stage where hopefully we can see, the end in sight. But we still will have to deal with the issues around the opioid overdosing and the housing. So our work is not done by any means.
Absolutely not.
United Way will be there to help with services and programs as we move through this.
Oh, absolutely. We're not going anywhere. We're working with all these partners. We have, developed new relationships over the last 2 years, and unique relationships of where before we kind of ran parallel. We knew they existed, they knew we existed, and every once in a while, you'd bump into each other in the community. Hey, how's it going? But now there's a full integration of what's going on, what's happening, what do you need, reaching out and saying, this has cropped up and that's your world. Can you help here? And it's like, absolutely, we're in to help, no problem.
I'm wondering if you could speak a little bit about the issue relating to homelessness is not just those you see on the street, on the steps in front of the stores, but homelessness can be hidden as well. And also address perhaps that we're seeing more middle income individuals who are challenged with affordable housing issues.
So what we're starting to see around, so homelessness is defined as somebody who doesn't have a place to rest, to sleep, that's theirs, and it's where they want to be, and it's how they want to be. So somebody could be living in a room, but they there's 3 people living in a room because that's all they can afford. That's not real proper housing. It's people who are couch surfing and staying with a different friend once a week, every other night. It can be all kinds of things, people who are in hotels. But what we're seeing on the real estate side of things is that exit from the larger urban centers with this work from home. And so where we may have in some of our more denser areas, those Victorian houses that have been split up into 3 or 4 apartments, they're coming in and they're purchasing them and returning them to single dwellings. Yeah. And so the rental market's coming off, and we're seeing more and more evictions for the homeowner to come and live. Are we seeing some of that predatory action of, yes, I want you to leave so I can put the price up? And we've got some new checks and balances around that. But it's a lot of, hey, I want to live here. It's also a lot of retirement. So people have bought the house 10, 15 years ago with anticipating retiring here to this area, and here's the opportunity to slide into retirement. I need my home back. Yeah. So there's a lot happening on the real estate, and we're not, we can't build faster.
Yeah. So certainly it's a supply issue, it's a housing purchase issue, it's a rental availability issue as well for individuals, which affects so many other things, including their health, their well-being, their ability to find employment.
There was a show on TVO. They did a piece on men over 50 who were homeless, and it tended to come from loss of a job due to a workplace injury, and then all the supports, the financial supports, just dwindled away. And a lot of them, when they hit the street, did not have a mental health issue, but within 3 months you develop one simply from trying to survive. And then that becomes that stereotype. Well, the only people that are homeless are people with mental health issues. Well, you live for 3 months precariously on the street, not knowing, not feeling safe, not actually being able to sleep properly and soundly, because you're sleeping with one eye open for safety reasons, you will develop a mental health challenge.
So as this message is going out to our communities, how can individuals support United Way and support these programs? This is your opportunity to put a plug in, because I know there is a need in a variety of programs. Maybe you could mention how our community can support you and the organizations that support those in most need.
So there's two things I'd ask the community. One, those that have a spare bedroom, those that have a basement that they could safely turn into a residence, consider that. You can reach out to Y Housing. They can walk through what it is to be a landlord, what the rules are. You can specify when it comes to room and board. I only want women because I'm a single woman myself. Those safety pieces are there. So if somebody has that opportunity, I encourage you to reach out to Y Housing. In terms of helping us on a day-to-day basis, donations, we're a 100% fundraised organization. You can go to donatetoday.ca and make a donation. It's all tax receipted and it supports the work we're doing. We're always on the hunt for things like socks and warm hats and mitts and all of those stuff things, winter coats, to support the people that are precarious out in the community. Warm winter boots, like proper winter boots, we're always looking for. And, I'm going to ask that this stuff be in good shape. Like the zippers need to work. Not necessarily the pocket zipper, but certainly the up and down front zipper should work. And that's what we need help with, to help other people to keep them safe.
I know this is not a test, okay? But just off the top of your head, can you name some of the organizations that are part of United Way that receive, the funding? I know there's a bunch, but I'm wondering if you could mention some of them, Francesca.
So we look at there are two ways that we interact. We do give grants out to agencies in the community. So Canadian Mental Health, Safe and Sound, the Women's House. We support some of the therapeutic riding programs, as well as a pile of food-related programs. But we also have what we call our partners group. So when we have, so later today, we have our weekly housing and homeless call, which has the YMCA at the table, Safe and Sound, our Indigenous partners. And that's where we come together as a group and who needs what, and how can we help, and what's on fire, and what's a success that way, and that's our partnership. So when people support the work we're doing, you're supporting hundreds, if not thousands, of people out in the Grey Bruce region. I think the last time I ran the numbers, at least a third of the residents of Grey Bruce are touched by a United Way dollar, just in what supports they're accessing in the community. And of course, we have 211. 211 Day is coming up. February 11th is 211 Day. And, if you just have a question about your community, that's who you call. You don't have to be low income to call 211. You can just need to have a question.
Yeah. So a lot of organizations, benefit from donations, from linking, from partnerships, and we encourage people to consider any way that they can help. It's been 2 years at least since we've been so actively involved with COVID-19 and helping people. My question to you is, how are you and all of the service providers coping? I can't help but wonder with the stresses every single day, because you're dealing with life and death issues every single day. How are people managing?
So we're okay. It's hard. Everybody is exhausted. It's
Yes.
it's absolutely exhausting, and it's left foot in front of the right foot, and you just keep going. And there's not a lot of bandwidth for innovation and the fun and that extra energy. Our focus is very narrow of getting through today, dealing with today's crisis, dealing with partners out there. But the charitable sector across the region, across the country, is exhausted from this. Our concerns around the anger and frustration in our community really worries us. We're very much worried about the attitudes in our community and the scariness out there of where that anger is going and where it's coming from, and who's that impacting. So, when we see things that are racist, when we see things that are gender violence, and are very scary because people are expressing their anger that way, there are communities that are really impacted by that anger. And, it's just an extra weight to carry.
That's a really good way to phrase it. When we're busy coping with survival through COVID-19 and making sure everyone is taken care of, the anger reactions are just one more thing that depletes energy and is a negative energy source. COVID-19 has hit a lot of organizations as far as staffing is concerned, where people have either had to be off because of quarantine, with their family, or they've had COVID-19. How has it impacted certainly United Way, but any of the service agencies? Have you any idea on where they are at this point?
So we've managed, face challenges, but we make sure, we follow mask and screening policies and all those things in place. We do know of agencies that have had to, have staff go home for a while, which impacts service delivery. And, we try and pick up the slack as much as we can. When we're suggesting to somebody, hey, you need to reach out to the ABC agency, if we happen to know they're short-staffed because of an isolation, because the kids are in school and all that, we'll say, hey, it may take a couple of days for them to get back to you, and don't panic about it. People are not ignoring you. This is just happening. But the not-for-profit sector doesn't have redundancy. We don't have any spare staff. We have to run as lean as possible financially. So we don't have somebody who can take on and pick up the slack of somebody else who has to go away. And a lot of the work we do is frontline. A lot of charitable work is not something you can do from home. It's engaging, it's with people, it's, that front line, talking to people, masked face to masked face. It's not easy to go home and do this work remotely because the people we're talking to, they can't connect to us remotely.
Yeah. And that, we talk about work from home and, all these, like we're doing today, the Skype, but that is not always a possibility because individuals don't have access. And, we can't assume that it's the same for everyone, for sure. So you're saying there's really not much buffer between being able to provide the service and the amount of human resources available to do it.
And we can't rely on the volunteers. I mean, that was always a big part for us, is that volunteerism. And, some of that more prosaic, simple office type support doesn't happen because we don't have volunteers. And, you think about all those volunteer driver programs and the screening, and, you may have an organization, one of the health charities has set up, 4 or 5 volunteer rides for the day. And, you go down to 1 or 2 drivers, that has a major impact.
Yeah. The other part is certainly when you require certain skills and talents to be able to work with the vulnerable population as well. And you mentioned volunteers having a role for sure, but that role may not match over all of the aspects of providing that frontline care. There's some highly trained resources out there that if they're not available, it's really hard to fill that gap for sure. From your perspective, from a year and a half ago to now, what's changed, either for you as an organization or the trends that you're noticing?
So if I was reflecting back, one of the words that really does come to mind first off is joy. It really is, because the organizations and the people are so entrenched in helping that those barriers that prevented partnerships before just all got through. We threw out the box. We didn't think about, oh, let's go outside and think about outside the box around this pandemic. We threw the box away and said, okay, you know, all those things we've always wanted to do, let's try them. Let's do this. And so there's been a lot of joy of those partnerships, of bringing siloed organizations on board. So that's been a big part of it. A lot more cross connection. The whole Zoom, Skype, whatever platform you're using has enabled a lot of people to participate more. So yes. Where we could say, hey, you know, Dundalk, why don't you come to a food meeting in Owen Sound? You know, that's an hour's drive. It's lunch. It's, you know, that's a lot of time for a volunteer. But when we can say, hey, jump on Zoom for an hour, and then they're still there, it created greater connection. And I hope it's one of the things we don't lose. You know, I miss that coffee, I miss that muffin, I miss that water cooler chat at a meeting, but seeing more people being able to connect and participate really matters, because, you know, distance is huge in Bruce Grey.
It is. And winter travel is never wonderful, even at the best of times sometimes. And you raise a really important point. People can participate, but also the team gets their input from a perspective which may be from their unique community that helps other communities as well. We talk about equity and access, but this opportunity with video conferencing allows for equity no matter where you live. You know, whether you live 5 minutes away or an hour away, everyone has the same opportunity and they're not disadvantaged. And I think that's important. You know, I had to write down the word joy because people have to work really, and I even underlined it twice, because people are working harder and harder to keep that spirit of joy. And I'm delighted to hear you say that, because right now it's dark. You know, it's dark. People are weary and tired. But that aspect of joy, the other word for me that you haven't said, but I will, is inspire. By seeing groups come together, knock down barriers, and provide service, doesn't matter what organization, is an inspiration to those of us who are watching it happen. And you may not even realize that, but that's a significant spin-off where you say, you know what, if they can do it, others can do it. And I think it does act as an inspiration on how our community can build and grow through partnerships. Changing trends. So you mentioned, you know, you hope the silos don't go back up again. Any changing trends? You know, we've talked in various programs that I've been on around, you know, the paramedics doing a different service model. Any changing models of service that you've seen or you think might change as a result?
Well, we're certainly seeing those in addiction services taking the services out in the community versus saying, hey, your appointment is at this hospital or at this doctor's office. You need to come to us. You know, you got a window. And if you're not there on time, well, then the next person, you know, sorry, you're not committed. Blah, blah, blah. Taking the services to the people. And a greater understanding of the barriers and the complexities of the lives of the people that we're working with. There's more empathy out there for those challenges. So that's a real positive piece too.
As we move forward and we start to address I don't like to say what's left from COVID-19, but what has evolved that may have existed before, but COVID has exacerbated. You know, we haven't talked about concerns about abuse in this, and I'm wondering if you can reference that around a reaction to stress and isolation and what you're seeing in the community around that.
There's definitely been an uptick in domestic violence. There's a real concern around children when they're not in school and children who are in precarious households, And whereas the teacher would be able to have those check-in conversations, how's it going? Did you eat today? Because they're home, there isn't that conversation. And then there's concern for nosiness. So when you are home and you're remote teaching, are people peering into your lives? Like, I got a curtain back here. You don't want to see the mess that is my office. So I hide it behind a curtain. You all think it's about the logo. No. There's a big old mess behind that.
Secret is out.
Yeah, honesty comes out. So, there's a whole thing around abuse. We have seen economic trafficking of people. We have seen sex trafficking, whereas that's the last resort of gaining some money or ensuring, a lot of sex trafficking involves sex for shelter. And that's definitely happening both from an informal as well as, hey, you're late with the rent. Well, honey, are you going to make my day? Because that's the only way. I'm not going to start kicking you out. So there's a lot of human exploitation that's happened as a direct result of the pandemic.
And for those who may, that may be a totally foreign concept for a lot of people, not to even realize it could happen in our community. And I'm hearing you say, yes, it is happening and it's on the rise.
Yeah. And we had the first call in early 2020, like even I think it was March or April, of an economically trafficked individual who was brought up here from Mexico to work somewhere, I have no idea where, and was rescued from that situation and popped into a hotel under the watch of the agencies, but he had no documentation to be in Canada whatsoever. And talking to Alex Ruff's office of, okay, the borders are closed. How do we get this guy home back to his family? And in the meantime, who's covering food and his accommodation and meeting all those needs? Because he's a victim of human trafficking. And dear sweet Alex was just like, wait, what? I was like, yeah, this happens. Catch up. This is what we're dealing with. But it does happen in our community, and we've got some resources behind it now too.
So that's at least out of something that was negative, there's an opportunity now and a system or resources available to help others.
I will say that the one thing I really want to make clear is when we miss the opportunity to fix something, when something like that negative happens and we think, oh my gosh, that's really negative, where if we don't address, that's where we fail. It's not that we failed in that negative thing happened in the first place. It's when we fail to act is when we truly failed.
Which takes me back in our last minute to say we have three issues. Obviously, COVID, homelessness, and the opioid overdose. If we fail to act, then we failed.
Yes.
And United Way can help by providing resources and services to those in most need. I want to thank you, Francesca, for joining me today. I always enjoy speaking with you. You have so much information, and I hope you'll join us again, but to talk about other things than COVID.
Absolutely. One day we'll play. We'll play again.
Thank you. And thank you to our viewing audience for joining us today. Please join us again to learn more about resources, services, and programs available to you and to your family. Take care and stay safe. Thank you.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
Hi, I'm Thomas Chase, a right wing with the Owens Attack. Go behind the scenes with your favorite team on Attack Rap every Tuesday on Rogers TV.